Hi guys, I'm Dr. Tara Tobias. Welcome back to my channel. Today we're going to do things a little bit differently. I'm not going to be teaching you an exercise, but hopefully I'm giving you some information that is going to help you get to the right information for your problems that are leading to the trouble that you're having with your walking and your balance. And that is, we are going to clear the air on drop foot. What is drop foot or foot drop? So I would say, before I go into the definition of it, that 90% of people, and this is just in my experience, you're probably going to find some literature out there that disagrees with what I say, but I would say 90% of people who have suffered a stroke and have difficulty walking or difficulty with their balance do not have foot drop. So let me explain. So foot drop is when muscles that lift the foot are weak, and so the foot goes down. However, when you go to passively bring the foot up, in most cases, if it is a true foot drop, you'll easily be able to dorsiflex the ankle and bring that foot up. However, this is not what most people have after they've suffered a stroke. Most people have high tone or spasticity in their gastrocnemius and their soleus and their posterior tibialis. So these are the muscles on the back of the ankle, and this is actually the more problematic area. So it's not that there's weakness, although there may be weakness in lifting the foot up. It's that the muscles, you have spasticity or high tone in the muscles that point the foot down and turn the foot in or invert the foot. Just a little side note, I am always so shocked and in such admiration of the questions that I get from you all who have no medical background. Your terminology, for the most part, is spot on. You guys do your research, you do your homework, you're online. I know you're online reading and trying to help yourself. And so that is truly, truly, truly why I am making this video. So now back to spasticity. So spasticity points the foot down and it inverts the foot, and that is because what I said earlier, high tone in the gastrocnemius, the soleus, and the posterior tibialis. That is more of the issue and the problem that is causing difficulty with balancing, difficulty with walking, and a lot of times it's a little bit painful. So the reason this is so critical when it comes to you all doing your own research or being your own advocate when you are working with a healthcare professional in getting your walking better is the treatment is going to be totally different, and the tools that you're going to use to help your walking is going to be a lot different. If you have a true drop foot or foot drop and you do not have spasticity or hypertonicity in the muscles that point the foot down, then you could benefit from a very minimal brace. You don't really need anything to control involuntary foot or ankle movement. So you can get away with a very lightweight brace that just lifts the foot up. When it comes to choosing the right exercises, you want to continue to stretch it because you could get a contracture in your plantar flexors, meaning your foot might get stuck pointed down, which does happen, but typically with a stroke, it's spasticity that's pointing the foot down. But you could get a contracture, so you want to make sure that you're stretching, dorsiflexing the foot, lifting the foot up. And the exercises are going to be different. So you could benefit from what we call functional electrical stimulation units, which provide E-stim to the muscles that lift the foot up. That is very, very beneficial. You could benefit from an electrical stimulation gait unit, which is actually something that stays on while you're walking, and it's really cool technology, but it just turns on when you're trying to swing the foot through. So it's timed with your walking. It's really, really cool. So that would really help improve your walking and your balance. Now, on the other hand, if you have spasticity, it's a little bit more challenging to get your walking and your balance back. Not impossible, just a little bit more challenging. And I feel a lot of people struggle because they are searching the wrong terms on the internet. And even some of their healthcare practitioners are probably using the wrong term. But if you suffer with spasticity in the muscles that point the foot down, your brace is going to need to be a lot more rigid, something maybe similar to this right here. I always go with an articulated brace if possible. You may need to put a lift in your shoe, or you may need to put something underneath your heel, so something similar to this. And the reason is that spasticity, the muscles that point the foot down, it gets worse when your foot hits the ground or when you get pressure on the bottom of your foot. So as much as you can, you want that pressure to be evenly distributed underneath the entire bottom of your foot. If you have a plantar flexion contracture and your foot doesn't actually get flat, a lift like this one really would help to decrease that plantar flexion spasticity, or that foot aggressively pointing down when you actually stand on the leg. So bracing is going to be different. Stretching is also going to be a little bit different. So there's something with spasticity where groups of muscles actually work together. One muscle group that usually works with the plantar flexors are the muscles that extend the knee. So when you extend the knee, that a lot of times will cause the foot to also point down, because those knee extensors, those quadricep muscles, they work together with the muscles in the back of the lower leg, those plantar flexors. So you would want to start with your knee bent to what we call, it's called like breaking up a spastic pattern. So you want to break that spastic pattern up as much as possible. Also, with your knee bent, your gastrocnemius muscle, the muscle on the back of your leg, it's not as stretched. There's a little bit more slack in it. So if you have just a tight gastrocnemius because you've had tone spasticity for a long time, then you would want to start with your knee bent. And the biggest reason to understand the difference is when you all are choosing the correct exercises. Now, I know it's frustrating not to be able to lift your foot up, and everything in you says to just go online and just look for exercises that will help you relearn how to lift the foot up. However, with high tone, it is very hard to activate or get those muscles that lift the foot up if you have all this resistance from the muscles that point the foot down. So, how do you get around that? So I know you want to get your balance back and you want to get your walking back. So what do? And this is where I lose a lot of people. You stand. And you stand. And you stand some more. That is the best exercise that you can do for spasticity in the foot and ankle. We call that weight bearing, and weight bearing helps to decrease spasticity. So weight bearing on that leg will actually help to inhibit those overactive muscles in the back of your lower leg. So I cannot stress this enough. In all your searches and in everything you're looking at online, I want you to keep in mind the difference between foot drop and spasticity, and make sure that you're doing the best that you can for your specific problems to achieve your highest mobility goal. For a lot of you, that is independence, that is confidence with balance, and that is walking. So I hope this clears the air on a few things. If you have any questions or comments, if you felt this explanation was good and you like these types of videos where I just explain something or explain a problem that's common with your diagnosis, hit that thumbs up button. I have a list that I collect of ideas of future videos, and the likes really help me decide whether or not this is something I want to invest more time into and create more videos in this area. As usual, hit the subscribe button so that you can get notifications on future videos. I thank you all for watching, and until next time, you all have a great day.